Hi everybody, my name's Ben Page. I'm the Chief Executive of Ipsos MORI, and I'd like to welcome you to this webinar, which is a joint Ipsos MORI and the Centre for Aging Better webinar on the experiences of people aged 50 to 70, of which I am one, during lockdown. I'm joined by my colleague Anna Dixon, the Chief Executive of the Centre for Aging Better, and she will speak shortly, but also by Nuzhat Ali from Public Health England, who's one of their national leads. And what more could we talk about at the moment? We're talking about COVID-19, and to have somebody from public health background. And then also, of course, the nation's finances, and including the finances of 50 to 70-year-olds, are going to change in all sorts of sometimes good, but often negative ways. And to talk a bit about that is my colleague Rowena Crawford from the Institute for Fiscal Studies. What we'd like to start off by doing, though, today is by playing you some ethnography that we've undertaken as part of the report that we're releasing today that looks at the lived experience of a range of people in the age group that we're talking about today. And my colleague Adam Hanrahan is going to run that for you now. So technology allowing, here it comes, ladies and gentlemen.
I've been very physically active in our big garden. I've been cycling, walking, and able to resume golf, so feel very physically fit.
So my hobby at the moment is the fridge. We have spent many an hour together during this lockdown.
Not a good day today. Bad head, banging. Feel very, very depressed today. So I don't know how the rest of the day is going to go.
You worry, I've got a mum, if my mum's not very well, I can't go and see her. So things like that upset me.
The only other concern for me is my husband. What with his knee, he's, waiting for this operation and he's suffering a lot in pain. And just wishing that they'd hurry up and make the phone call for him to come in and have his pre-med, then have the knee done.
I do just miss my children and my grandchildren terribly. That's the main thing. I don't know how we're going to deal with not being allowed to have what we call a huggle.
I went and did some shopping for an elderly neighbour. I do that most weeks, and she's always really appreciative of what I do for her. And it's always really nice to be helpful as well, or to feel that you're being helpful. And it's nice to feel appreciated, which I do.
This is where most of the work is going on, here in the kitchen, and here's the toilet and little sink, and we will be having a partition built around that.
You're indoors here, and we've got the doors that fold back, and you can go out and sit at the table in the shade, or you can sunbathe here. We do schoolwork over at that table and eat in the evening if the weather's good.
I have found that the house is getting me down a bit because it feels too cramped, too small. There are 3 adults and 3 dogs in a small 2-bedroom cottage.
My mental health is suffering because I don't know what I'm meant to do. Waiting and waiting for the kitchen to be fixed, the bathroom to be fixed. I just want it to be nice.
I'm socially distant from any other staff because the office is in the house. I don't anticipate that I would have a problem continuing to do this in the future.
Yeah, I'm 51 now. It's a weird age because you're too young to retire. It'd be lovely to retire, but most people are going to be too young to retire. But getting a bit old when it comes to sticking your CV in places.
Unfortunately, whereas I'd like to be retired at 60, the reality is I'm going to probably have to work until 70 and beyond, maybe.
For us, it gave us a lot more time to consider what we needed to do during the pandemic, how we needed to keep safe, what were our priorities really.
That starts to give you some of the flavour of the issues that we're talking about. And I think one of the principles at the Centre for Aging Better, which Ipsos MORI shares, is the need to actually understand people's lived experience. And that sort of research is vital in really putting some, in a sense, flesh on the bones of some of the stats that I'm going to very briefly, in a very short death by PowerPoint, give you now, before I hand over to Rowena, Nazat, and to Anna. So in terms of the key findings from this nationally representative study of 50 to 70-year-olds, what are we finding? And the first thing is that, of course, most of these people are working, and 36% of them, interestingly, were key workers. And I think that's a reminder that you know, there is still plenty of people busy working, and of course making the economy tick over and doing some of the jobs that we needed doing in lockdown. But also, of course, they're squeezed. Many of them have got elderly relatives themselves. I have my daughter, 2 grandchildren with me in lockdown, my partner and my elderly mum, who I care for 24 hours, and she's 100. And one of the, of course, one of the great things about an aging society is, of course, the extra years of life that everybody is having. But of course, it also means that people who would often have been, in a sense, have already lost their parents in the past, are still looking after them for much, much longer when they themselves have got caring responsibilities. Lots of signs in the research of these people being active in their community and making a big contribution. I was just reflecting on myself. I'm 55. I became the shopper for my 70-year-old neighbour during lockdown. And you know, there is still, of course, the existing health inequalities. And one of the things that's already been commented on over COVID-19 is how, whether you're looking at inequalities in wealth or indeed in health, it will exacerbate them. So people who are over 80 are 70 times more likely to die than those under 40. But actually people in this age group, of course, were also statistically more likely to die. We lost 20,000 people in care homes in England and Wales between March and early June. And in terms of people's money, well, obviously people's work has changed and people are now reflecting on where they work. I think the jury is still out as to exactly how permanent changes in at least patterns of work and where we work are. I think my personal best guess would be that up to 20 to 30% of people who are commuting daily will probably stop doing that. We hit a tipping point with existing technology. We've got a third now thinking about early retirement. Whether or not they always have the money for that is another matter. And then, of course, another quarter thinking about career change. So this is a major moment. People are always going to remember, in the same way that they could remember what they were doing when Lady Di was killed in an accident in Paris and they heard about it. They will remember the year of COVID-19 and its aftermath. And that is leading to all sorts of, I suppose, evaluation and questioning, in a sense, scrutiny of authority, scrutiny of the way things are done. We've got lots of these people not confident that they'll be able to find work in future. In fact, very few are. And this, of course, starts to get to one of the big consequences of a potential rise in unemployment that we're now seeing. The number of hours worked in statistics released today is about 18% lower than earlier this year. There's still millions of people on furlough, but furlough will run out. And it looks very likely the unemployment numbers will keep growing. But if you become unemployed amongst this group, we can first of all see that those who were already unemployed the majority of them were not at all confident about getting a job. And the new unemployed, aged 50 to 70, if it's anything like the recession after 2008, will also find it very hard to find employment and may end up in a forced retirement. We've got 2 out of 5 worried about their their economic prospects. The self-employed in particular, which is interesting, 2/3 of those expecting it to get worse. And that's that group, of course, who are more likely to have fallen through the furlough scheme if they couldn't prove certain things. They hadn't been self-employed for a long time, they didn't have a year of accounts or whatever the criteria were. So it's that stands out very, very clearly. But virtually everybody is expecting to be worse off rather than better off. Only a minority of better off people we found nationally in some analysis that we did with Andy Haldane of the Bank of England managed to increase their savings during lockdown, and they were generally the better off. People on lower incomes were spending their savings, and that's of course exacerbating existing financial pressures and the people who are winners and losers in our economy. In terms of community, there are some positive signs. 84% of the people that we spoke to who'd volunteered said they wanted to do so long term. And I think one of the positive things that we could look for from the pandemic for this age group and indeed for others is that idea of community, all those WhatsApp groups that we've set up, those neighbours that we started talking to for the first time, or et cetera, those things sort of staying. I still am a bit pessimistic that as if life eventually returns to normal, some of that will dissipate. But nevertheless, we've got 9% claiming that they volunteered formally, 3 in 10 doing informal things to help in their community, and wanting a lot of those, the vast majority of those, wanting to continue afterwards. So they're certainly making a contribution. One of the key challenges facing this group, we know at the Centre for Ageing Better, is of course the sorts of condition of housing that people find themselves in. And other research that we've published recently shows that particularly renters and people with outside space have suffered during lockdown. Interestingly, most of these people are saying actually they haven't experienced any problems with their homes during lockdown and that they're reasonably happy with them. But when we dig into it, of course, people with less space are particularly focused in the rental sector, shortage of space, noisy neighbours, and particularly interestingly, social housing in particular, talking about a shortage of space, not so worried about insulation, but certainly about the standards of maintenance, and renters generally, particularly private renters, worried about housing conditions. And overall, if you look at well-being in other surveys, it is renters, particularly private renters, who are most negative about quality of life and indeed the quality of their housing. Part of this is because 3 in 10 renters don't have access to a garden or any outdoor space. And I must admit, I don't know what I would have done without my garden during lockdown. I can only have imagined if it was a few years ago and I was in an overcrowded, smaller flat. The other thing, of course, that we've seen is in national surveys, when we asked people in another national survey recently, what one improvement would you make to your house? And it wasn't energy efficiency, it wasn't even better broadband, it was simply more outdoor space. So pretty similar sort of findings that we're seeing here. In terms of people's health, we've got around 4 in 10 saying that their mental health has deteriorated, particularly high among people who are workless, slightly, and for all these groups that we're identifying here, renters, people living on their own, a bit higher than the average. I think overall in Britain, we've had about a quarter saying that their health has suffered. So these group of older people have actually suffered a bit more. It's also true that working mothers with children at home are another group, but today we're looking at the 50 to 70-year-olds, and you can see very clearly that people are concerned about their mental health, and also their physical health is suffering. So we've got 2 in 100 who say it's a lot worse, but around a quarter, 23%, saying it's deteriorating, and that's far fewer than say that perhaps because of more exercise or something else it's got better. Particularly, and it's also, of course, combined. You've got this, I suppose, intersection of physical and mental health. If you were ill before, you're unlikely to have got better. We can see, of course, that lifestyle changes. So small numbers of people, of course, are doing a bit more exercise or trying to eat healthier. But actually, people who smoke are smoking more, partly because of the stress. It's tempting to go to the fridge, as we heard in that film. And I'm in good company, being among the 11% who drank more alcohol. And my new post-lockdown rule is only booze every other day. Because certainly at certain points in lockdown, especially early on, I was definitely in this camp. But overall, it's more negative than positive. And again, we need to think about those consequences. They're sort of compounded, in a sense, by the effective closure of large parts of the NHS during lockdown. 1 in 5 missing a routine hospital appointment, 5 in 100 missing a routine operational surgery, lots of issues around dental appointments. And talking informally to the head of Cancer Research UK recently, I was told there is an informal estimate of between 30 to 100,000 extra deaths or extra early deaths as a result of failure to turn up for cancer screening that didn't take place, or indeed delayed treatment. So, again, this is the age group that's going to be more likely to get ill, and they are, as perhaps predictably, suffering. Do they think that the media have been discriminatory? Well, a quarter say yes, but more say no. Is it concerning? Well, actually, they're not particularly concerned about it, although they do think that different age groups have not been considered equally. So they don't feel, interestingly, particularly that they've been stereotyped, which is a theme that we at the Centre for Ageing Better, but also at Ipsos MORI, think is a serious issue in terms of ageism. Personally, I think ageism is probably one of the last permitted biases that you're allowed in Britain at the moment. But overall, they're not particularly negative about that. A minority of them are, often I think older ones, but certainly some issues there. So I would just sum this all up by saying that they're making a big contribution, clearly. A lot of them are actually doing some of those jobs that we need to actually keep ticking over in lockdown. Long-term risk of scarring for the economy and for their personal employment and health implications. I think the evidence is, and again, I'll be really interested in what colleagues have to say, but it's likely to hit the young and the old hardest. And I think this particular issue that we're very concerned about, we already have underemployment amongst the over 55s, but that's likely to be exacerbated in the coming recession and with the coming recession and rise in unemployment. And finally, when we start to talk about a rebuild and some changes to the deal that we give to different people or levelling up, while the young are going to be the centre of attention sometimes, those of us who are also concerned about people at the other end of the spectrum, who are living hopefully longer than ever, we can't lose focus. That's the end from me. Let's drop out of that. Rowena, would you like to go first in terms of how you reacted to that data when you saw it?
Absolutely, and I guess first I would like to say thank you to Ipsos MORI and the Centre for Ageing Better for such a valuable report. I think it's really insightful examination of the circumstances of older people in this crisis. And I think one of the nice features actually is the holistic nature, thinking about the whole picture of how the older population is affected, rather than I guess the sometimes siloed view we've had until now of kind of the health effects on the old and the economic effects on the young. I think it's really quite valuable to think about the effects on multiple different dimensions at the same time for the same people. So I wanted to respond by highlighting what I think some of the key findings are and some important areas of concern going forwards. Notwithstanding the fact I've just said it's really useful to think about all this as a whole, I'll focus mostly on the kind of economic, what you could label the economic implications, just because of my background relative to others on the panel, but very happy to pick up other aspects in this discussion later. So one of the key things for me was one you touched on at the end, Ben, is the employment and financial consequences of this crisis for older people. A lot of the discussion about these issues to date is focused on the young, and that's right. The young are disproportionately affected by furlough, and we've seen from today's figures they're disproportionately affected by unemployment as well, and that's because they work concentrated in these vulnerable sectors. And the consequences are bad for them. We know there's scarring effects of entering the labour market, particularly in a recession. But I think older people are going to be badly affected by this as well. This report and others have reiterated that older people are very active in the labour market, more so than ever before, partly because of increased longevity, increase in the state pension age, partly because we've got cohorts of women reaching older ages having been more active in the labour market in the past. So older people are going to be more affected. And also the consequences of employment shocks, financial shocks, older ages could be worse than for prime age or younger working adults. We know from previous research that job losses from previous recessions and even just job losses at older ages in general, older people are less likely to re-enter the labour market. They take longer. They're more likely to re-enter on lower earnings relative to what they were earning before. And often proximity to retirement is seen as a help in that context. It's limiting the detrimental effect for older people, if you like. You're closer to, you're going to retire soon anyway, therefore the fact you lose your job, hits you for fewer years, if you like. But for many, that perceived proximity to retirement is actually a hindrance rather than a help. It could directly cause some of these issues with taking longer or being less likely to return to the labour market, either due to biases of potential employers or because of the effects on individuals' own attitudes or behaviours or confidence in their job seeking. And it really matters. I mean, I say proximity to retirement, it's not necessarily that close. You know, you take someone 50 today, they're not going to get a state pension for another 17 years. That's a long time to be disadvantaged in the labour market. And these could be really crucial years for saving and planning for retirement. If you were planning to do a lot of your saving in the run up to retirement, then these years, you know, you have lower earnings, less capacity to save. That could have really long-term implications. And particularly for people that have been affected by stock market falls as well. We don't often talk about that, but a lot of these people reaching retirement have accumulated pension wealth that's just seen a fairly significant hit to some of the value of those equities. I think someone in the qualitative aspect of your report was talking about having to work for another 18 months to make up for the loss of their pension value. So for some people, these years are going to be really, really important. So there's a risk that people aren't just going to be disadvantaged in the short term or until retirement, but actually that this could have persistent financial consequences for the rest of their lives if it affects their retirement resources. And it's not all just about money. Suppose you know somebody has to leave the labour market, they opt out of the labour market a year before they were planning to retire anyway. In some sense, that it's a year. What difference does it make? But actually, involuntary retirement, the loss of control over when you leave the labour market, has been shown to have important mental health effects. You know, it can actually be really detrimental to people's well-being to have to leave work even a short period of time before they were intending to. So I think the key findings for me were the large proportions of people lacking confidence about their ability to get to return to work in future. I think that's really important. Also, the proportion of people, I think it was nearly a third that were considering early retirement. And also, I think you didn't mention, but in the reports, 14% of people considering delaying retirement. So there are big changes in people's, potentially people's retirement timing. And that can be for good or bad reasons. I mean, it could be reassessing lifestyle factors, reevaluating your priorities, but it could be, indicative of people being discouraged of, some of these other concerns about the labour market. So I think it's going to be really important going forward to monitor how older people are faring. If they're struggling, probably important. Try and get out in real time, ideally, why that is, and having policy that's nimble enough to respond to that. And I'm not talking about favouring older people, because this is a crisis that's going to affect lots of people very badly, but in very different ways and for very different reasons. I think it's just about making sure older people aren't unduly disadvantaged in what's coming. So there were some of the key takeaways from me. Yeah. But very happy.
And that's really interesting. And we've started to get some questions, which which partly relate to something you've said, but we'll come to them. So thank you to Alistair McQueen at Aviva for his question. We will pick it up. From a public health perspective, Nuzhat, how does it feel to you? I mean, it's an unfolding event in the sense we aren't at the end of it, but how does it feel?
I think in terms of the public health perspective, it's just brought to the fore things that we've known for decades, things that we in public health have been talking about and have been highlighting for several decades. And I think COVID has just really heightened some of those issues and brought those inequalities specifically to the fore, and the factors that actually contribute to those inequalities to the front of people's mind as well.
Okay. And what's the are you in terms of getting out of this, or the amount of effort, funding, or change in policy to deal with some of these things? Are you optimistic or pessimistic at the moment, Nuzhat?
I'm optimistic. I think, like I said, I think it's brought to the fore things that within the public health arena and people that understand public health, we already knew about, but actually it's really sort of sharpened our awareness as a society to some of those issues that as we go forward, that we need to really focus on. So those are some of the reflections that I will share with you.
Yeah. I mean, I think it's really interesting in the sense that, during lockdown, of course, after the murder of George Floyd in America, we saw in our monthly polling in Britain the highest ever level of concern about race relations. among white people, but also even much, much higher, of course, among Black, Asian, and minority ethnic people. And I think that, but also in business, and I don't know how it feels for other people on this call, but we were already making positive steps because of things like measuring gender equality in pay. And I think now, with some of the events of lockdown, and I think that the lockdown has in some way sharpened the focus. I think certainly in business, there is certainly a lot more attention to diversity and inclusion. And hopefully that will be one of the positives. That, I mean, although it was exacerbated by, it's a whole series of negative events. In America, to me at the moment, and I speak as someone whose relatives, whose family are half American, America seems to be one series of negative events, quite frankly. But ultimately, perhaps in Britain and America, in business and in government, it will see more focus, as you say, on those issues. And any other reactions, Nuzhat?
So I'm going to share 3 reflections that I've had reading the report and also bringing in some of the public health work that we've been doing. So the first is the recognition that health is an asset and we need to invest in that. And when I say we as individuals, but then also as a society, as a government. So that's sort of really important, and I think that's brought to the fore within the work that you've done, but then a whole range of other research that's happened in the last 6 to 9 months. Mm-hmm. And understand that in order to improve health and well-being of not only this particular age group, but right across the life course, that we really need to be collaborating across whole systems, and systems are complex. And actually, sort of when we look at what we do, I bring Marmot into the whole picture, and people will be familiar with Marmot.
Introduce him. Some people on the call won't know who Michael is, so do you want to tell them about Michael Marmot?
So Michael Marmot is the guru of a whole range of things, but health inequalities is his area of expertise. And he, over the last probably 40 years, has done a significant amount of work in terms of inequalities and what really matters across the life course from childhood up to older age. And one of the areas that he stresses on is the importance of wider determinants. And what are those wider determinants? So things that have been raised in the report, but income, finances and employment, and the impact that has on health, the importance of communities and social connections, and the impact that also has on one's health and well-being, and the physical environment. And Ben, you talked about gardens earlier on, and outside space has been highlighted, and that's really important, especially during COVID and the lockdown. But you know, when we're out of this, it is really critical, and it's important in terms of policy speak that we take note of that. Housing has also been highlighted in the report. I was quite surprised that it was less than I would have thought, but which is a good thing, but it wasn't sort of brought out as an issue as some of the other areas of research, the housing. And then one of the areas that you touched on, which is really important, and it isn't talked about, or as much as it has been in the last 6 to 8 months, is the discrimination around ethnicity, gender and age, but also structural racism in society, and how that has contributed and continues to contribute in terms of health outcomes. And we've seen that in 2 reports that Public Health England published in July. One was around the data around disparities and during the time of COVID, and the other was a qualitative piece of work that we had undertaken with several hundred stakeholders, and bringing to the fore some of those issues around discrimination that impact. I mean, one of the things that strikes me that I keep reading is, okay, and it's all right, so Asian households, intergenerational, overcrowded, but actually why is it intergenerational, why is it overcrowded? And that there is a huge element around that in terms of discrimination and access to some of the services that we have. So that's my first reflection. And then in terms of sort of what the implications are, I think the investment in programs that address social and environmental determinants of health outside of what we do in public health, but in other sectors, I think going forward, that's going to be really, really important. And that aspect of collaboration and partnership as we go forward. The second area I'd like to highlight, again, and the report has re-emphasized this, is the intrinsic link between physical health and mental health. And that's been brought out in the data that you've shared with us. But then also I lead within Public Health England, I lead on musculoskeletal health, and it was interesting to see that people with a physical health condition that had been exacerbated also reported worse mental health. So as we go forward, I think it really brings to the fore the importance of us as health professionals, how we ensure that when we're looking at prevention, we're looking at care and treatment, that we treat people holistically, and we're not just talking about body parts, which is what we've been doing, but how do we have a holistic approach in terms of how we manage people's health. And my third reflection is around inequalities, and I've said it's heightened our awareness around inequalities and the very deeply ingrained inequalities within society. And four areas specifically. One is around the socioeconomic impact, and a big factor that has had on inequalities that have come to the fore during COVID, but then also those inequalities that we've known for decades, but yet we haven't been able to actually have a significant impact to reduce inequalities. Second is around occupational risks, and that has been again brought out in a lot of literature and evidence during COVID, the occupational risks, and who are the people that bear the brunt of those occupational risks. And the third is around gender, and the report has brought that out again around the impact that it's having on women. And I'll just point out some of the areas that I picked out from the report is that women were reported as drinking more, eating more unhealthily. They were finding it harder to stay positive. And the fourth area was around caring responsibilities increasing as well.
Women have definitely had a worse deal. As the only man on this call, I will say this, but or at least visible man on this call. Women came out, particularly women who are juggling family and caring and work, as particularly suffering mental health, and that's here and elsewhere in numerous studies. So as usual, women are doing the most work.
And I can probably vouch for that, because at points I'm quite resilient. I'm thinking, God, I'm not normally feeling like this. What's happening? So yes, I think that what do we do around women if this COVID, as we know it, we're not going to come out of it very quickly, but a real focus on women and women's health and resilience. And the fourth area is around BAME communities and the ethnic inequalities that this horrific pandemic has again highlighted and brought to our attention more so in this 50+ age group, where we know the demographic are changing in terms of first, second generation people in this age group. And then just one, it's more of a question that I'll just throw out really, because I've been thinking about, right, what are the implications regards healthy life expectancy as a result of what we are experiencing currently, and how and what needs to happen in terms of improving that healthy life expectancy. So I'm going to stop there.
No, thank you. Well, there's plenty of food for thought there. Hold the questions. I'm going to come now to Anna, Anna is the Chief Exec at the Centre for Ageing Better, and it's all about how Britain gets ready for being older. Anna, what do you take from all of this? You're muted, I think, possibly, but maybe not.
I think I am. I thought that somebody else was in control of that. Apologies. Just firstly to say, I think it's been great collaboration with Ipsos MORI, and really brought a very rich data to help us illuminate the experiences of people at this particular life stage. And the reason that the Centre for Ageing Better is interested in people in this life stage approaching later life is because we think there are opportunities to intervene to hopefully mean that they do live a longer, healthier and happier life. And obviously COVID, there is a very, very significant focus, particularly on the 70+, partly because the initial advice was very clear about the clinical vulnerability of people of a particular age, and the implications for them. And as I think Rowena was saying, you know, a concern, particularly from the financial point of view, around the young. And so I think for us, we felt there was a need to make sure that we did understand the impacts on this group approaching later life, not only for what's happening to them now, but as we've been discussing, you know, what are the long-term implications of this for their long-term finances, in terms of will they be more or less likely to be financially secure in later life? And I think Rowena has done a fantastic job of sort of summarising what some of those potentially long-term challenges will be for people as we understand it. But also, as Nuzhat, you were saying there at the end, you know, understanding how do these sort of changes in people's mental and physical health play out over the next 20 years, and what's that going to mean for potentially people living with disability for longer, or, you know, we have seen potentially not living as long if they are experiencing some of these challenges earlier and for longer. So, so our interest is really what can we learn from this in terms of shaping policy and practice. So I'm going to just focus very briefly on some of the policy implications as we see them from the data and evidence. And obviously, Ben, as you were saying, our sort of mission as an organisation is to bring about those changes, but informed by and based in the evidence. So in terms of health, you know, I think as we've seen, there is certainly a potential that this is going to, for some at least, have a longer term impact on their health. And, you know, potentially there's already quite high rates of obesity and alcohol consumption in this age group. And as we've seen from the data, there's a suggestion that at least for a significant minority that could get worse. We've also seen, as was highlighted, missing out on some of the healthcare. And, you know, there are obviously risks there of things being untreated at an early stage, leading to further deterioration of those conditions, and therefore resulting potentially in a longer period of disability. So I think this really just calls for a renewed emphasis from government on prevention. You know, we had Matt Hancock pre-COVID saying that prevention was one of his priorities. There were sort of moves to bring forward policy proposals. They need to be much more radical about government regulation, whether that's on food or alcohol in terms of minimum unit pricing. And also, you know, a much stronger focus on health inequalities, because I think one of the things that COVID has really shown is the differential impact that this is having, as Nuzhat really highlighted. I mean, I guess to focus on the positive, we saw a little bit of an improvement in physical activity. We need to understand who that is, because I fear that it's the sort of probably the more active getting even more active rather than the inactive getting active. So at the Centre for Ageing Better, we are really focused on how do we get people who are inactive to get a little bit active. And I think things like active travel, where, you know, if we could really push walking and cycling as alternatives, I think that there is some further we could go on that. So that's the sort of first area on health. I think a worry that this group may enter later life unhealthier and with greater disability than past generations unless we take some radical action. So the second, obviously, is the points that Rowena was making about what a vital part of the workforce this age group are. You know, they make up a greater proportion of the overall workforce than in the past, because there are just more of them and fewer younger people entering the workforce. So it's really critical that we do look at their long-term employment prospects and try and put in mitigating actions to, first of all, you know, stop them potentially disproportionately falling out of work, but certainly recognizing this lesson from past recessions that they're much less likely to ever get back into work. And so here we're really calling for tailored employment support. So this is not about, you know, should there be money for the young or provision for the old? This is about making sure that there is provision for people of all ages, and that that provision is tailored and targeted and effective for the particular group. But it's not only about government and so on, it's also about employers, and you know, about not being age biased, and whether that's in the way they treat people coming off furlough, how they structure their redundancy. You know, this idea of, oh, well, it's okay to take early retirement and we can get rid of a few people that way. As Rowena said, that has very significant negative, both psychological and financial implications for those people. And, you know, where there are sectors that hopefully will start recruiting again in the future as we come out of this, making sure that there isn't age bias, so that people in their 50s and 60s who want to return to work both have access to those job opportunities in a fair way, and are not, as we heard from one of the qualitative people in the videos, feeling like they're already being overlooked because of their age, and something that the Centre for Ageing Better we're working on. And then the third area I'll just touch on briefly before we go to discussion is the helping out. So it was the glimmer of positive news in what you shared there, Ben, of more people volunteering and people wanting to continue to volunteer. And I think particularly this informal, so the research that we have done previously as part of our joint review on volunteering in later life with the DCMS, the Department of Culture, Media and Sport, has shown that it's actually there is a sort of stronger inequality in formal volunteering, but actually where people have health conditions from BME backgrounds or from poorer communities, they're much more likely to participate in informal volunteering. So it's opened up new opportunities for people, and key, I think, is going to be sustaining those opportunities, both as people get back to work and their circumstances change. So we're really calling for partnerships between local government, national government and the voluntary sector to really support people to sustain that volunteering. It will also perhaps require employers to be more flexible too, and to make sure that those opportunities are sort of age friendly and inclusive, and enable everyone to contribute in a way that I think we've seen through mutual aid and some of those. So yeah, let's not overlook this group. I think there are some long-term consequences if we do, and look forward to the discussion.
So we've got one question's come in from Alistair McQueen at Aviva, who's saying, well, I noticed that there's a kickstart scheme for youth employment where employers are encouraged to hire, I think it's under 24s, somebody will correct me. There isn't anything for unemployed over 55-year-olds, which I thought was interesting. And maybe that's just a reminder that we need to keep, we'll have to keep making these points, because, as we've already pointed out, it's very likely that this age group will suffer in as much in some ways as people leaving education at this stage.
Yeah, and I think it may not be the same, and I think this is where the tailored thing comes in. So it may not be a sort of kickstart for the over 50s. That might not be the intervention that's really needed. So I think it's important just to understand, you know, what is the intervention, what is the labour market intervention that's going to be most effective for that group. And, you know, for some, it may actually be better access to retraining and on-the-job skills, rather than the need for some sort of supported, paid for employment opportunity, because obviously many of these people have got experience in the labour market, and employers, you know, hopefully will see the value of that, but it may be that they don't have quite the right skills to match the jobs available in the labour market. So I think it's just about saying, yes, you know, we don't necessarily want to kickstart for over 50s, but we do want tailored employment support that works.
Yeah, is there something? It seemed to me in various contexts, with another hat on, I'm involved in looking at Britain's financial well-being from birth till death with the Money and Pensions Advice Service. But one thing about this crisis, in a sense, we can see it in the data, there is a moment where people will take stock, even if they've kept their job, even if their circumstances haven't changed. We can see that in people wondering about, why do I want to kill myself to pay a mortgage to live in inner London, when actually it's turned out I don't actually have to be there every day, for example. And so is there an opportunity in certainly in looking at later life? We've sometimes talked about a midlife MOT. I don't know what PHE's current view on that is, but to try and get people to use this psychological moment, in a sense, to get people to look at their finances, Rowena, to get people to take stock on their health. I'm now on a downward weight trajectory, having discovered exactly how much I put on during lockdown. 5 kilos off so far, 5 kilos to go. But is there a moment that we could somehow capitalize on? And is that something that across government and with people like Aviva in the private sector, we should be doing? I don't know. I'd be interested in everybody's reactions and indeed the audiences.
I mean, Ben, the idea around the idea around having that MOT, the health MOT or finance MOT, it's a great idea, and it's something that in the work that PHE started around productive healthy aging, it was something that came up quite a lot in terms of looking at those particular points where people may want to sort of look at their finances, but having that offer provided by their employer or outside of that employer. So it's an attractive idea that I think potentially has, you know, can positively have, is a positive intervention with positive outcome.
But it's certainly something employers could encourage, you know, could even subsidize to a certain extent. We already provide, I mean, just for Ipsos MORI provides financial awareness training. We hire loads of numeric graduates, but they can't work out savings and mortgages, it turns out, if they're not listening graduates. So the just basic financial awareness training is popular. So I could see that that could be something, if we're focusing on the resilience of our people in the most generic sense, that, you know, some movement for that might be a good idea. I don't know, Rena, what do the IFS think we're going to do about? Are you just looking at the numbers, or do you have some recommendations or suggestions? I mean, we should all save more, obviously.
Well, not necessarily. It depends on the standard of living you want in retirement.
Yeah, sure.
You know, one of the effects of this crisis might actually be that how you viewed your spending in retirement has changed quite a lot. Maybe you thought you were going to be going on exotic holidays every year, and now you've realised actually what you want is a nice house with a garden, and you'll stay at home. Yeah. And that could actually really change, you know, a whole trajectory of what you thought you were going to do. I mean, related to your question about kind of opportunities in midlife MOTs, one thing that I think is an opportunity that's a bit uncertain at the moment, but could be really quite valuable, is changes to work practices. And if they continue, that could be a real opportunity for everybody, but particularly for older workers, a lot of whom were already wanting more flexible working from home, better, you know, more flexible hours, those kinds of things, as a way of enabling them to stay and work for longer, juggle caring responsibilities, phase into retirement, that sort of thing. And if this crisis has shown employers that these sorts of working practices work and that people can cope with them, and it's all very productive, then there could be real long run benefits of people being able to do those kinds of positions more. I mean, from my own personal experience, there's an unintended adverse consequence, which goes back to the inactivity and kind of keeping the inactive active. That I think an awful lot of people probably got more exercise from their daily commutes than they realised, and haven't replaced that with anything active. So I think there is a potential health risk that if everyone starts working from home, we'll all end up potatoes. But you know,
sometimes I realise I haven't left the house for 3 days or something because I've got food in and I'm working hard, and then it's sunny. I just stay at home. You know, I mean, and literally, I might, you know, I have to make yourself go somewhere. Yeah, no, it's a very good point. But I think it's positive. You know, looking at those positives. I mean, that is a good one. That not requiring people to, you know, slog in on a 1.5 hour commute. One of my finance director retired at 60, and I asked him what the best thing about retiring was, and he just said, waking up at 4:30 every morning in Buckinghamshire to get to London for, you know, 8 o'clock or whatever. You know, and that you didn't need to retire. In fact, I must try and get him back from retirement. You know, I mean, you don't have to do it anymore. Anna,
absolutely right. The flexibility is really critical to retention, and you know, particularly important to older workers. And yet we know they don't often know they can ask for it, or employers are perhaps not as open to requests or the types of flexibility and reasons for it, which may simply be, I'm tired of a full-time commute. So I do think there are opportunities, but I'd just like to come back to the point about midlife MOT and midlife review, because as you know, Ben, we've done quite a lot of work on this, you know, working with some of the early pioneers like Aviva and Mercer and others who were trialing early versions of midlife MOT, mainly with their own employees, and we sort of worked with them to capture some of that learning. But we also did a more structured evaluation of some what were billed as pre-retirement courses. This was a joint program with the Gulbenkian Foundation. But actually people sort of started them quite a way before retirement, and the key there was having a psychological component. And I think what we're seeing from this data is that there's almost this moment to take stock. And what we found from some of the participants on that course was the main thing was a moment to say, okay, I'm going to take some time out to actually think about my future, and to think about it actively, positively. What might I want from my later life? And it led people to change their decisions about how long and when they would retire, whether they wanted to work part-time as a sort of transition, thinking about taking up volunteering. And so we've taken the lessons both from some of the midlife MOT pilots and from that evaluations of the retirement courses, and brought that together as a sort of guide for employers. Now that was all pre-COVID, so I think your point is, could this be beneficial now, and who to? And I think the new group who it could be particularly beneficial to are the people who are facing this risk of redundancy, because actually, as we were hearing from Rowena, there's a real risk that some people might almost make some bad choices because they've sort of internalized the idea, oh, it's not, I'm not far off retirement, and actually, if they were able to look at their health, a realistic view of how long they're going to live, a realistic view of the sort of costs of their living standards that they need to have, even for perhaps a lower level of living than they might have thought, they need help with that. It's a lot of quite complicated sort of decision making. And so I think there may be something about almost trialing it, because at the moment I think it's very much the sort of people in good jobs with money who help them think about career, help them think about positive choices and savings and planning for retirement, which there is a market for, and important it is. But I think it's this at-risk group that we're talking about here who could right now find themselves making some quite poor decisions if they're not given the right support. So I think a version of a sort of midlife review, potentially developing and testing for that group, could be really important.
We're hearing in the chat from large companies that they think there is a very good return on doing this, and they can show evidence for that. We've got one comment from Connect Hackney, which is about digital inclusion for the over 50s, and it's just a remark that big business, and I'll take this back to my largest client, who's actually Google globally, and that those companies like Google and Facebook aren't doing enough on digital inclusion among the over 50s. I mean, it is right, it's massively higher than it used to be. But the last time I looked, I think it was older working class women. There was still a very large minority who were not online in any shape or form. The figure in Britain as a whole is about still 7% of the population not online, and among some of the groups that we might be most concerned about, it will be at least double that. And increasingly, with services being pushed to digital, there is a real risk. I mean, so I don't know if there's any strong views on the panel about that.
So not a view on that per se, but one of the things that I was quite interested in the report, which I don't think was mentioned in your presentation, was I think 75% increase in proportion of people using video calls, or done more video calling than they had previously, which I think really demonstrates actually the flexibility of this age group in some ways, that when a need arises.
That's a very good point. Very good point, Rena, actually. And I think, I mean, this crisis has introduced particularly a lot of the over 50s to this technology that we're using today. I mean, in the economy as a whole, there's been more growth in e-commerce in Britain and America in the last 6 months than there was in the previous 6 years. And it would have been higher if the logistics were actually capable of meeting the demand. But I think it is an interesting point. If we all think about, my father is 83, and I have a regular Tuesday night chat with him now, which I never used to do before, but we do it on Zoom every week. And I think that's something that there's been a digital acceleration in society as a whole. But I think actually it's a very good point that there should have been one, we would hope. And it's unfortunate, it's probably for those who are a bit more affluent and have the kit. It will have been among those people who turned on their iPad and started using it for calls when previously they were just browsing on it or something. So that's a good point.
So I think with the evidence suggests that in terms of digital exclusion, there is obviously still a very significant age gradient, but there is also a socioeconomic gradient. And so what you do find is that lower educated sort of and perhaps non-professional workers, it may be that there is some internet use, but it's generally social media, and it's often through a smartphone device. So what they don't have the digital skills for is the sort of more advanced computer use that you would probably need in some of the jobs that are available. And so actually there's two things where digital skills really impact, obviously in terms of economy and in terms of health, which Rowena and Nazat may want to comment on further. In terms of jobs, it's job seeking. So a lot of these 50 and 60-year-olds, when they were job seeking previously, this would not be the way to get a job, and it's now literally the way to get a job is through online platforms. So it may not be that you need this digital skills to do the job, but you need them to get the job. So there's something about helping those older job seekers, at least with the job seeking sort of a side of it. But then there obviously are jobs where even in the past you wouldn't have needed much, but their skill set may not be matched well to what's needed for a workplace digital skills, having perhaps only used it in a very limited way for social media. So I think there are some implications there which perhaps haven't been the focus of policy. Again, I think there's been a lot of focus and some really great, how do we get tablets to people in care homes? How do we get the over 70s online so that they can sort of maintain some social connection? All really important. But again, like, we need to just be really specific about what the issues are for different cohorts and within that. And obviously, you know, accessing healthcare services, you know, Nazat, you may comment on this, and also some of those wider determinants in terms of social connectivity. Increasingly, you know, GP appointments, everything going online. Again, just making sure that that people do have sort of access to those things.
Yeah, absolutely. I was just going to bring in that point that you've just mentioned, Anna, that we've seen an significant increase in digital technologies, specifically in primary care, with people that probably never used an iPad before, and now they're having that consultation in primary care with their GP, and feel quite confident and comfortable about it. And so, I mean, from what I've seen, I chair a BAME women's group. We used to have coffee mornings weekly, face-to-face, and over the last 6 months, those coffee mornings have been done digitally. And the age group is anything from 30 right through to 80, and they're all on their iPads or on their smartphone, having a virtual coffee morning. So I see it as potentially in certain groups where there are socioeconomic inequalities, the access to the actual sort of devices, as opposed to sort of them not knowing what to do when it comes to some of these things.
I see we're sort of running out of time, so I'll give you all one magic wand. You get one wish finally before we finish at 3 o'clock. So yeah, there you go. And I didn't tell you I was going to do this, but Rowena, what one policy, if I can put you in charge for a day, what would your favourite thing or most preferred thing be?
Gosh, my one wish I think was that this had never happened. Yeah, that's tough. I think some. Yeah, it's really hard. I think some sort of policy that really gave the support needed to older people looking for jobs who perhaps haven't done it for a while, and as Anna was saying, don't understand the way you would even go about that these days. I think for me that's a bit fluffy, I'm afraid, but that's
but it's specific, and I think Anna makes the good point about it being targeted, and I think it's getting enough space for a government that's busy with Brexit and day-to-day COVID to actually think about some of these things. I suspect that may be part of the challenge. Nazat, what would you go for?
Oh gosh, blimey. I think for me, my concern is that COVID has potentially really sort of increase. We're seeing increasing inequalities, and we need more resource, more will to actually work across a whole system, to actually really focus on those groups in the population that need that additional support and help, to actually level the playing field. So that
well, it's a government that's about levelling up, and in theory, at least, the NHS will get quite a lot of money in theory. Anna, what would you go for finally?
Yeah, well, thankfully Rowena's waved one of the wands and another. So if I've already got a tailored employment support programme and a focus on health inequalities, I think really it would be this issue of getting away from age being the defining factor, and recognising that we do have to support people in this life stage, particularly those who are already experiencing challenges, and the sort of get away from the idea that our chronological age, the problem is a health problem for 70 plus or a work problem for those in their 20s. And we've got to really face up that people at every life stage and in every generation have got health and economic challenge, and therefore we need to find solutions that are going to work sort of for everyone. So I suppose getting away a bit from the ageism that we had when we first went into lockdown.
Brilliant. Well, the hour is up. Thank you so much to the panel for their time and contributions. Thank you to the audience. Thank you to the team at Ipsos MORI and Centre for Aging Better who put this together. And we'll do it again. And let's hope for positive outcomes. We could have this conversation in a year's time and we'd say, well, that was good, what they did. Let's wait and see. Thank you very much, everybody. Bye-bye.
Thank you.